Very important. Your patient is going to say, I really think I'm overweight because of sugar. And you can reassure them that sugar is not health food, and soda is not health food, even if it's Dr. Pepper. So that said, if that is all they are focusing on, they are missing something important. And this is going to be on the test, people. A gram of sugar has 4 calories, a gram of fat has 9. Are you with me? Okay, your patients forget this instantly. So I want to make sure we got this. How many calories are in a gram of beef fat? Are we sure? Good, okay. Chicken fat? Fish oil? Even if it's wild-caught salmon? Okay. Olive oil? Extra virgin olive oil? Extra virgin olive oil? 1040 motor oil? If you cooked with it, it actually does have 9 calories in every gram. Okay, so when you go to a restaurant, they're happy to make you a vegan meal, but they're going to slather it with olive oil because restaurateurs are in love with their oil. So I'm going to raise a question. Once again, sodas are not health food. People should throw them away, and your patients should not be having them. However, sweetener consumption has been falling in the United States ever since 1999, when bottled waters edged enough sodas off the shelf that sugar and sodas has been falling. Cheese, on the other hand, has gone in the opposite direction, and so what? Is there any fat in cheese? The leanest beef, the leanest chicken, fish, and plant foods, you could see that this is the fat content as a percentage of calories. Where is cheese? Is it more like the beef? Is it more like the broccoli? Where is it? Okay, typical cheddar cheese, mozzarella cheese, 70% fat as a percentage of calories, mostly saturated fat. So we feed this to kids because it's got some protein in there somewhere, in amongst all the fat. But keep in mind, very, very big contributor to weight problems, I would guess. Now, you can get a sweet taste from soda without any calories. There is Coke Zero. There is no Cheddar Zero. Okay, so it's always got calories. All right, so which is better for weight loss, cutting the fat or cutting the carbs? You can lose a lot of weight on a low-carb diet, and people do, and weight loss is a good thing. However, why do I lose weight on a low-carbohydrate diet? Carbohydrates are it's the majority of the calories in an average person's diet. So if I take out all the fruit, and all the grains and all the bread and so forth is gone, and all the beans are gone, and all my pasta is gone, I take out all the carbs, I'm going to lose weight. Unless I eat so much fat and protein that my caloric intake stays the same, in which case you will not lose weight. So these diets do not defy the laws of thermodynamics. But the problem is that if I remove the carbohydrates, I may end up with a cholesterol problem. Now, I may not. This was a study, weight loss normally causes a reduction in cholesterol. And everyone's different, but typically a pound of weight loss will drop about roughly a point off your total cholesterol. However, if I achieve my weight loss with a low-carb diet, these numbers come from the Atkins Diet Revolution book, saturated fat and cholesterol content very, very high. And if you contrast that with, say, a vegan diet where there's effectively no cholesterol, not much saturated fat, your prediction might be that the Atkins person is not going to do so hot. Well, at Duke University, in a 6-month study, 29 participants in the study had LDL reductions, which you should have because you're losing weight, your cholesterol should fall. But 12 of the participants in this study had LDL increases. The average increase was 18 points, and one had an increase of about 100 points. So this was sort of a shot across the bow. So they did another study, also 6 months, and 30% of the participants had LDL increases above 10%. So in Philadelphia, around the same time, they did a 1-year study and showed that the average person's total cholesterol went up, their average person's LDL went up, and the conclusion that the researchers have come to is that a big concern about low-carbohydrate diets could be that it's not going to help your lipid levels very much and could make them worse. Okay, but your patient will say, but I need to lose weight. Will this help me lose weight? And the answer is it will, but Ken Hall and his group, many of you know Ken because he was here a couple of years ago at one of our earlier conferences, did a really interesting study. He brought 19 men into NIH, and they lived there. And they had isocaloric diets that were either low carb or low fat. And he measured their body fat very carefully. And in a day's time, you could lose about 53 grams of fat on a low-carb diet and about 89 grams of fat on a low-fat diet. And at that point, Ken kind of closed the book and said, people can use low-carb diets if they want, and some people will do well because it may be better than what they were doing before. On the other hand, the advantage for going to a low-fat plant-based diet is fairly clear. Epidemiologically, the American Diabetes Association published these data in 2009, looking at BMI in Seventh-day Adventists. And the reason, of course, that they look at Adventists is you have a largely non-smoking, non-drinking, health-conscious population, including many vegetarians and vegans and so forth. And looking at BMI, as you know, BMI, healthy BMI should be below 25, we'll say. The meat eaters in this group were at 28.8. The semi-vegetarians were about 27.3 on average. And these are people eating meat less than once a week. Pesco vegetarians, pesco meaning fish, okay, a little bit skinnier. The lacto-ovo vegetarians, a little thinner, but I always have to tell my patients that a vegan is not a person from the planet Vegas. And as you'd expect, they're the thinnest group. And then when we look at diabetes prevalence, you see the same kind of difference, only somewhat more dramatic. And part of this is artifact because your vegans are more health conscious. They're typically better educated and they exercise more and so forth. But even when you adjust for those variables, the vegans have about half the risk of developing type 2 diabetes compared to the meat eaters. So let's shift gears and talk a little bit about diabetes. At Yale University, Jerry Schulman and Kit Peterson and their team have been doing some really, really interesting work on the causes of insulin resistance. And through MR spectroscopy, you can look inside the muscle cells and see what's going on there. And if, to simplify this a little bit, this is a muscle cell, and the reason I'm showing you a muscle cell is that glucose, that dreaded glucose, which is what your diabetic patient is worried about, my blood glucose is too high, glucose is trying to get into muscle cells. That's its main target. It'll also go to liver and it'll go to other cells, but most of it goes into muscle. And there it is outside the cell. But to get into the cell, it needs the help of a hormone called insulin, which is a little key that is going to go into that receptor. And the attachment to the receptor is normal in your diabetic patient, in virtually all of them. And then it signals these channels to open up and let the sugar inside. And that's what's not normal. That insulin signaling isn't working. And what's that about? And through MR spectroscopy, the finding is that the buildup of fat particles inside the cell is interfering with insulin resistance, interfering with insulin sensitivity. And of course, doctors hate words like fat because it's just one syllable, so we'll call it intramyocellular lipid. But it's the buildup of fat, largely from dietary sources, interfering with insulin sensitivity. So in our research study, we were funded by NIH to test a diet that in theory ought to change that. So we tested a vegan diet that was also low in fat versus a diet that I'm going to call following ADA guidelines, which at the time meant reducing caloric intake and keeping carbs fairly constant throughout the day. It was a 22-week study with a 1-year follow-up, and we've published a number of papers from this study, but just one quick finding. When you look at the patients who did not need any medication change in the course of the study, those people on the ADA diet had a good result. They dropped their A1C by 0.4 points, which is good. But the group on the plant-based diet, the vegan diet, dropped by about 1.2 just on average, which was terrific. I mean, that's the kind of thing that you want a really good medication to accomplish, and they did this just with a diet change. So this is a meta-analysis came out a couple of years ago of every study looking at plant-based diets and their effect on A1C. And now the zero line is in the middle there, and as you can see, the effects are pretty consistent, that you see improvements. And that's really, really important, because a plant-based diet has rice in it, and it has pasta, and it has beans, and you're encouraging your nervous patient to eat these foods, and they have been hearing for years that these things are going to affect them, and they will. They go home and they eat your spaghetti, and their blood sugar rises for the first few days, because they're very insulin resistant. And then after a while, something happens, which is their blood sugar starts to fall and fall and fall and fall. And what we believe is happening is their intramyocellular lipid is starting to dissipate, their insulin resistance is starting to go away, their insulin sensitivity is returning, and you're reversing the course of this disease. How far will it go? It really depends on how soon you intervene in their life. You can't expect that a person whose pancreas has been pummeled by this disease for 25 years to throw their medications away and be diabetes-free. But on the other hand, it makes sense to have every patient begin this kind of regimen as soon as you can, and all the side effects are good ones. Their cholesterols fall, their blood pressures fall. We've seen many patients where their erectile dysfunction improves or goes away, and you're going to have happy patients. So there you go.